Hello and welcome to today's edition of Community Matters. I'm Jennifer Vale Storrs. Thanks for tuning in. The Minnesota Department of Health changed the way people will be tested for the coronavirus. To ensure there are enough tests, the tests will be reserved for hospitalized individuals, health workers, and congregate living situations of higher risk individuals. As of Tuesday, the state had 60 positive tests. The Minnesota Department of Health advises people who may have symptoms to practice quarantine measures. According to the MDH's Chris Erzman, getting a test would not change recommendations for people with mild symptoms.
Having a positive COVID test for someone who is not hospitalized, who has mild symptoms, is not a magic bullet. It doesn't inform, the treatment because there is no treatment, and it doesn't change our recommendations for staying home when you're sick. So let me just reiterate, if you are someone who has upper respiratory symptoms and you are able to manage them at home, and now you realize that, I'm not going to be able to get tested, that is still okay. It doesn't change, the recommendations that your healthcare provider might give to you, about resting, fluids, that type of thing. And it certainly doesn't change our recommendations about staying home. We want people who are ill to stay home for 7 days after their illness onset or 72 hours after resolution of fever and improvement of respiratory symptoms, whichever is longer. So yesterday I gave an example. If your illness lasted for 4 days and you were without a fever for 3 days, you'd be golden with the 7-day time frame. However, if your illness lasted for 5 days, you still have to tack on that 3-day period without a fever, and so then the time that you would need to be isolated would need to be 8 days. And we also want to make sure that the household and intimate contacts of these individuals are also staying out of circulation or limiting their public activities for 14 days after the person who is ill, has been identified as ill, that they're staying out of circulation for 14 days.
The Itasca County Board of Commissioners met for their regular work session on Tuesday afternoon. Public Health Director Kelly Chandler gave a presentation to the board. Also, as part of her report, she had Emergency Manager Marlon Halverson address the board as well.
In regards to the emergency management aspect, as a county, I'm helping support any other needs that they may need. But I look at this as not only county, but we also have 16 jurisdictions within Itasca County. What are their needs and where are they at? Hence the reason why we had the meeting yesterday, to find out if we're all on the same page, if we're exchanging information, how can we exchange information and moving that information and sharing that information forward. But not only locally within Itasca County, what are we doing regionally? Within Region 2, we have 11 counties, 5 tribes, and 1 city of the first class. We're not the only county this is being affected with. So how can we work as a region within this? So if something happens in Itasca County, is there ways of us getting resources, supplies, needs, or anything else like that? So on the regional level, we're also working with our Northeast Healthcare Coalition group, which is a group out of Duluth who includes Arrowhead EMS Association, as well as a representative from Minnesota Department of Public Health, MDH, as well. So again, it's all about that collaboration, resource sharing, information sharing.
This was about a 20-minute presentation. You can watch it in its entirety on demand on our website at watchictv.org. Today we're going to talk a little bit about hunger. First off, Sue Esty, Executive Director of Second Harvest North Central Food Bank, has this message.
As I follow the news and receive updates on COVID-19, I'm thinking about the thousands of people being served by food shelves and soup kitchens, people who don't have the ability to stock up and prepare for this virus due to a lack of resources. At Second Harvest North Central Food Bank, our #1 job is to get food to hungry people throughout north central Minnesota. It's important for us to identify and plan for ways that our region may be impacted in the coming weeks and weeks and months due to the COVID-19 and how the food bank will respond. Second Harvest will do everything we can to continue to provide food to hungry people throughout our region. That's why we are keeping the food shelf at Second Harvest open during our normal business hours, which are Monday through Thursday, 11 to 3:30, and Friday, 10 to 1 p.m. Please note that due to social distancing, those that visit us will not be entering the building, and we'll be providing prepackaged, non-perishable, and frozen items outside. Directions will be located outside the food shelf. If you're from outside Grand Rapids, you can contact your local food shelf for questions on local distribution. We're producing non-perishable emergency food packs of pantry staples for food shelf participants. We're creating a list of volunteers to help fill those packs and to do other projects at the food bank. We're working closely with Feeding America, our Minnesota food bank partners, public health, school districts, lawmakers, and others to determine our best response to this ever-changing public health impact. We have and are continuing to source additional food and non-food items ahead of what is likely to be an increase in demand. We're checking in with our network of agency partners, food shelves, soup kitchens, and shelters, to assess their needs and learn how we can best support their local efforts. We're implementing distribution methods that will reduce person-to-person contact, keeping our employees, volunteers, and our neighbors safe. We're advocating for legislation to increase funding and provide flexibility for federal nutrition programs. We're ensuring the highest standard of hygiene in our facility for our employees and our volunteers. And we're working with our member hunger relief agencies throughout our region to ensure that they have the food they need and guidelines to follow to protect themselves, their volunteers, and their participants during this time. What can you do to help? Many of our volunteers are senior citizens. For their safety, we have asked them to remain at home. But if you're healthy, please volunteer. If you're ill, stay home and help prevent the spread of COVID-19. Your support is critical to our response, so if you can, please make a gift to assist our most vulnerable neighbors. And know that things are changing day by day, and we'll do our best to keep you informed. We recommend you follow us on Facebook for timely updates. Our Facebook handle is @SecondHarvestNorthCentral. Thank you in advance for your support during this really critical time.
The Community Cafe in Grand Rapids will be adding Wednesday night dinner service until further notice, so Tuesday, Wednesday, and Thursday from 4:30 to 6 p.m. at the Keesler Wellness Center. They are located directly behind Walmart in the building at the top of the hill. In an effort to maintain the most safe and sanitary conditions, they will be offering takeout meals only. In Deer River, Community Cafe is open Monday through Thursday at King Elementary. Use their back door, please. Also from 4:30 to 6 p.m. with takeout meals only. Please spread the word to those in need. If you need meals for your children during school closures, the district has created a form on their website at www.isd318.org. If you do not have sufficient internet access, please contact your building secretary for aid in completing the form. Well, that's it for today. From all of us at ICTV, thanks for watching.